As we all know now, as each day passes, we continue to learn more and adjust to meet the challenges of the COVID-19 pandemic. The pandemic, it hit us really hard with unprecedented speed, scope, and scale, both the public health aspects as well as the devastating impacts on our business and economy. I think I've heard the word unprecedented used more in the past 2 months than probably in the history of the English language, but it really does kind of capture what it is that we're trying to grapple with. And today we're going to discuss the impacts on our public budgets and how we can bring our region back to fiscal and economic health. And we're really happy to have with us Virginia Secretary of Finance, Aubrey Layne. Aubrey, thank you for joining us. Chief Financial Officer of the District of Columbia, Jeff DeWitt, and Maryland Comptroller Peter Franchot. Thank you all for being here with us. Really do appreciate this. Each is going to offer us some brief comments, and then we will open up to questions. So please use the Q&A feature at the bottom of your screen to submit questions, and we will get to those. We'll share this session on our website later this week. With that, again, I want to thank you all for being with us, and I'll turn it over to Jeff to get us started.
Thank you, and thank you, everyone. Just to give you a quick 5-minute overview of where the district's budget is, as many of you know, we're on the federal fiscal year, unlike Maryland and Virginia. So our fiscal year ends September 30th. Which gives us a little bit more time in the current fiscal year to deal with this, as the word was used, unprecedented downturn. We did a forecast in February of this year, and the COVID-19 was kind of in the news, but it was more in China at the time. And we had raised some concerns that may affect the forecast, and I think that was probably one of the understatements of the period, because it really truly has. In the district, we reforecasted our revenue. We delayed the mayor's budget to May 12th, which was normally in early March that would happen. And we reforecasted the revenue last Friday. And in doing that, that's a particular challenge because you don't really see it in the tax receipts yet. You're starting to see it, but you'll see it in a much bigger way very shortly. So we have had weekly meetings with the hospitality industry, the Restaurant Association, the Hotel Association, the Convention Center, Destination DC, and we went to a method to forecast where we're looking at month by month. When do we think we may open, and what level of percent recovery would you be at in each month through the end of 2020 to reforecast the revenue? And just to give you a flavor for the impact on the district, about 60% of our restaurants are open, and those are doing takeout only, so they're running about 20% of normal revenues. 40% are closed. So you're getting about 12% of your normal restaurant revenue right now. 88% is gone in the current shutdown mode. And in the hotel side, this is our peak period for the district typically, where typically all of them are 90% full in a normal situation this time of year. And conventions are roaring rather well at our convention center. About half of our hotels are dark, they're completely closed down, and the ones that are open are running between 5 and 10% occupancy. So they're just really functioning, waiting for people to come in to lobby the federal government to use those hotels and other things that will happen later. And so we're getting almost no money from those. And then obviously parking revenue is down because no one's coming into the district. We double our size every day from people in Maryland, Virginia coming in, and they're not coming in, and so there's no parking revenue coming in either. So when you look at that, and then our unemployment numbers, we're projecting to hit 18% in July is our current forecast. So we'll be at 18% unemployment, largely in the hospitality industry, which is lower average wages. So the income hit is probably in the 5 to 7% range, even though the unemployment would be relatively high. So when you package all that together, the reforecast we did, we're projecting for the current fiscal year to have a revenue reduction of the February forecast of $722 million. That's on about an $8.4 billion base. And then in 2021, about $773 million drop. And then it reduces down, but it's still in the $600 to $500 million range all the way through 24. The district balances budget not only on the current fiscal year and the budget year, but it acts the budget over the financial plan period as required under the Home Rule Act. So we have to have a balanced plan through 2024, and that's particularly difficult. We're looking at a major assumption in our forecast that it would happen in phases. We'll be in a shutdown mode. We'd be in a reopening mode where restaurants and hotels and conventions would gradually come back. We're assuming that we won't be back to whatever the new normal we're going to call it will be, which will likely be different, until the middle of 2021. So we're not assuming a V-shaped recovery, a rapid rebound. We're expecting more of a U. We're down, we're going to be flat for a while, and then we're going to go back up. And maybe even more of a, some call it a Nike swoosh, where you're down and you start a gradual recovery when you look at our information. If you look on our site, cfo.dc.gov, you'll see the presentation that shows the graphics and the assumptions that we make. And the revenue letter is also out there as well, where you can see the assumptions of the forecast. So across the board, it's about a 7% cut on all revenues. Things like convention center are looking at 40 to 50% losses in revenue because their dedicated taxes come from the hotel and restaurant industry, so they're going to be reforecasting as well. So that gives you a flavor for the district. About 7% general fund hit, with some dedicated funds like the convention center being hit rather dramatically in that category. So that's where we are.
All right, Jack, thanks again. This is Aubrey, Layne, Secretary of Finance in Virginia. And first of all, I want to start by letting Jeff and Peter know, really appreciate the cooperation we have between the different localities, and I know they're working hard, so I really appreciate their efforts. Much like Jeff said, obviously the revenue situation in Virginia has been significantly impacted. We are on a June 30th year end, and that's especially important this year because the timing of when this crisis hit. We were in the middle of a biennium budget, and at the end of our fiscal year, and much as Jeff described, at the end of February and beginning of March, we sort of had an inkling this was coming, but nobody knew the quite extent of what was going to happen. And of course, shortly after our legislature left here at the end of February is when the governor issued this emergency of health and the beginning of our closure of our businesses. So significantly changed what was a very strong economy going into a budget cycle to one that's something completely different as we look now. We have roughly a $22 billion annual budget. And as I mentioned, we are a June 30th year end, meaning that the impacts of this are going to hit in our final quarter. So we estimate probably around $1 billion will be lost over April, May, and June, their final quarter. And of course, some of that's been difficult to assess. We'll talk about later. We did move when we expect individuals to pay taxes in the Commonwealth. So trying to get a handle not only on what the public health crisis has been, but some of the issues we've taken to mitigate it to taxpayers and what that's going to do on our revenues. But as we said here today, it looks like having seen April, which we didn't start feeling the effects of this until the end of April, beginning middle to the end of April. March was still up 10%. We're on a delay in receiving receipts, particularly our major sources are individual income taxes of almost 2/3 of our revenues, and sales taxes almost 20%. Both of those significantly hit by the public health crisis we're in. So in the current fiscal year, obviously liquidity and cash flow planning is a big issue that we're dealing with right now. Fortunately, we do have a couple $1 billion in reserves that are at our disposal, and the governor has suspended all discretionary spending, no new hiring. That may require us to do further things as we get into the next biennium budget, but right now that's what we're really looking at as we go through the end of this fiscal year. Now, looking out into the biennium budget, we still don't have a very clear picture of what the revenue situation is going to look like. But we had done a reforecast at the beginning of this current calendar year, and if we anticipated one of our scenarios was a medium recession, that would require a reduction of about $1 billion to $1.5 billion each year in revenues. We certainly believe it's going to be at least that amount as we go forward. Virginia law requires a reforecast if our revenues are different than more than 1% of our budget. That's going to happen this current fiscal year. We'll be required to do a reforecast here probably at the end of June. That'll also mean that we'll have a special session of the General Assembly to take further budget action. What we did in the current budget without having a good forecast, the current biennium budget, is to unallot or suspend over $2 billion in spending over the biennium budget. We fully expect a lot of that's going to actually have to be eliminated as we look at a new projection here in the next few months. But certainly, we do know we're going to have a fairly significant impact on our budget, not only the current year, but the next 2 years. Much like Jeff said, we don't expect this to be a very quick recovery. Although we went into it very quickly, almost an immediate shutdown, getting the state back open for business, it's going to take some time. It's going to require, I know there's some questions later about public confidence. Unlike we might have went through in 2001 with September 11th, when people were afraid to fly to get the economy going, that was pretty quickly resolved by the government and TSA. Not going to be the case this time. It's going to be individual businesses, even though the states may say, hey, everything's okay to start opening up, the public's still going to have confidence in every individual business or location they go to, or they're not going to return. So that gives us not a lot of clarity. We expect to have a little bit more of that as the governor begins to open up the economy over the next month or so. And that will probably result in additional budget action and being taken to eliminate more spending as we go forward. So that's an overview of where we are now. I know there's some other specific questions we'll get into later, but much like I'm sure my counterparts are, a lot of uncertainty and trying to make sure we maintain, as we are required to do, a balanced budget over this period of this crisis. And so with that, I'll turn it over to Peter to tell us a little bit what's going on in Maryland.
Thank you very much, Aubrey. And Jeff, thank you for your kind comments. We in Maryland value greatly our relationship with Virginia and the District of Columbia. It's an important asset for us. Jack, I'd like to thank the Board of Trade for organizing this. I'd also like to give a tip of the hat to, well, in Maryland, we have a Republican governor. I'm a Democrat, but he and I have pledged to work together on this because we're going to have to take some significant actions. And I know Governor Northam and Mayor Bowser have also really stepped up to the plate and I think done the right thing. I happened to be comptroller years ago when we had the financial collapse in 2007, 2008, 2009. We cut billions of dollars out of the real-time budget then in Maryland. Because of that, it was a very painful process. I can't really describe the situation because, you know, we in Maryland have a Board of Public Works. So unlike the legislature, which normally is involved, we were making these cuts on our own, the treasurer, the governor, and myself. And unfortunately, that's going to pale in front of what we're going to do over the next 4 to 6 weeks in Maryland. We're going to have to, as Aubrey was talking, each of us have significant reductions, but his and ours in Maryland are particularly significant because our new fiscal year starts July 1st. So we estimate we're $2.8 billion short in revenue. We have 340,000 Marylanders who file first-time unemployment in the last 3 weeks. That's a big underestimating. We expect it to be corrected negatively in the near future because so many people couldn't get through to the system. So 90% of our hospitality industry is shut down. We have some significant economic, I don't want to overstate the word, but it's going to make the financial collapse look a little bit like a picnic, frankly. And so we're prepared to do that in Maryland. We want to do it in a smart way and in a cooperative way with the region, and we will do that. I happen to think that we're going to win the medical battle sooner rather than later. I have a lot of confidence in the global scientists. I think our governors and our mayor are doing the right thing by focusing on that. But obviously now we need to turn to the economic recovery. I happen to think we can win the recovery, just like I'm hoping we can win the medical issue. What do I think we need to do? I think we need to realize that this economic recovery gives us a possibility to do things in a much more innovative and collaborative way in the region, and frankly also in our own state. So I was on the phone with all the presidents of the private colleges in Maryland on Friday, and they were telling me about the tremendous challenges that they face. And it's very clear that, for example, that one sector alone, they're going to have to admit students in a different way. They're going to have to house students in a different way. They're going to have to teach them in a different way. They're going to have to charge them tuition in a different way. So every sector that I know of in Maryland is going to have to either reinvent and nimbly adjust, or they are going to face significant problems as we move forward in the recovery. And I'll just conclude by saying, I think there is an opportunity there for Maryland to position itself as a state that's much more friendly to small businesses. I think it allows our legislature to focus on keeping money in the pockets of small businesses and citizens and Maryland families. In other words, change the kind of perception that we have in our state. And working with Virginia and DC, I think we can advertise our region as a really terrific place to live and retire, most importantly, because a lot of our people are headed to Virginia and Delaware, as far as I can tell. But we'd like to make Maryland a much more business-friendly, family-friendly state as we rebuild. And as Jeff and Aubrey were both saying, this is a multi-year effort that we're entering.
All right, that's great. Yeah, all right. Well, thank you. Well, some questions are coming in, and then I had a few questions as well. So let's jump into a conversation about that. Just give us, as we think about this, just give us a little background. I mean, how are you all working? How are your teams working right now? Jeff, it looks like you're home. Aubrey, it looks like you may be in the office. How is that going? I mean, and do you guys find yourselves putting in a lot more hours over the day? And then how often are you picking up the phone and it's either the governor or the mayor? Have those calls increased a lot over these past few weeks?
I will start. You're on call 24/7 now. So it's not uncommon for a elected official to call at 10 o'clock at night because they know where you are. You can't, say I'm at dinner because you can't go anywhere to eat. So they know where you are. And in terms of the total unexpected, we use Microsoft Teams and Mayor's office uses WebEx. The collaboration and the efficiency, maybe it's because we're working so many hours, is actually, I would say, up. We're running our entire tax office remotely. I'm over the tax division. And so the call center is in people's homes. We can track it. So ironically, productivity's up. And it's probably going to make us rethink what it looks like when we go back, which I never in a million years would have expected. That's what we're seeing.
Right, great. Aubrey, how about you in Virginia?
Yeah, I have been coming in the office every day, primarily because of the governor's mansion is right across from the building that I'm housed in, and his office is right down from mine. I speak with him pretty much 3 or 4 times a day as we've gone through this. We have over 100,000 employees, though, in the Commonwealth, and the overwhelming majority, I think a little over 80,000 of them, are telecommuting. And just like Jeff has mentioned, we are finding that the efficiency actually has not suffered, and in many cases, it has improved. And that may be because of longer hours. I know Peter mentioned and Jeff mentioned, you're right now, everybody knows where you are. You have your cell phone. So I get pretty much calls most of the waking hours and sometimes during some of the non-waking hours as we go through this. Although, as I think that'll change a little bit as we go forward. People are going to have to get used to this being with us for a while. We expect at least for the next year, as we work through this until a vaccine is obviously in widespread use, we're going to have to continue to do this. And so much like Peter mentioned, I think there's going to be some positives come out of this that we're going to continue to do into the future, particularly as continuity of businesses or government is concerned. So just a lot of long hours, but it's part of the job.
Peter?
Yeah, no, I work from home. I happen to think the virus is just as dangerous and nasty as it's described. So I'd like to make it through on a personal level. And once again, I salute all the elected officials in the region because That's a first, second, and third priority. In addition to helping small businesses in the economic recovery, I think we need to get off of this bake-off that we get into with Virginia and DC sometimes for Amazon, God bless them, but we need to focus on small businesses. But government infrastructure is number two. I mean, our unemployment filings technology has completely frozen and collapsed in Maryland. So people desperately need to get unemployment. They need to register. They can't do it because the system's overwhelmed. A lot of the systems in Maryland still use COBOL, I'm told. We've modernized the state's tax system, so that's still, knock on wood, functioning very smoothly. But a lot of it's automated. We have our, teams of IT people in generally, but most people are operating from home, similar to what Jeff and Aubrey said. But as far as the future, one thing we need to do, at least in our state, is significantly upgrade the technology that we use to interact with our citizens and get the job done. And then finally, I'll just reiterate, education funding, healthcare funding, transportation funding, it's all going to change because we can't go back to the same old, same old.
Great. So, let's talk a little bit about, Aubrey, you touched on it. We've all touched on this a little bit about restoring the public confidence and trust. That seems to be a critical element to the various phases of reopening, to getting revenues flowing again, and to get back to some kind of a level of new normal. What are you all seeing and what are you all working on in your states and in the district with regards to how do we get that trust back? How do we build that confidence? And how do we get people back and engaged with all of our economic institutions?
Well, obviously, I think you're right. That's going to be key to the revival of not only business, but our revenues here in the Commonwealth. Testing is going to have to be a major part of that, and possibly contact tracing as we move forward. I think the state, at least here, we believe that is going to be the key, not only to the public health issue, but to reopening the economy as you get, again, people more comfortable going into various establishments. In that, we think that's probably going to be something going to be with us for at least 12 to 18 months. And so that's a lot of the focus we're looking at now as we've immediately responded to the health crisis with buying personal protection equipment, the social and the health needs. One of the things that the stay-at-home orders have done is to keep us from overrunning our hospitals. That looks like that has worked. So now as we look to reopen, how do we get, as you mentioned, Jack, how do we get confidence back? And I think you'll see us invest quite a bit in a statewide and working with businesses on testing and contact tracing. Virginia's behind in this. We're not as up to speed as other states should be. And that's going to be a major effort with a task force just formed here as we focus away from the direct impacts into how we're going to be able to cope with this over the next 12 to 18 months.
Jeff, how about in DC?
Yeah, so I agree with everything Aubrey said. Testing and tracing is a big issue here. We're looking at hiring 900 people in an organization that would be put together to do that and getting the testing capacity up, which it's not there yet. The mayor kicked off, I believe it was Wednesday, a Reopen DC task force. It's led by Ambassador Rice and Secretary Chertoff. And I sat on there on the steering committee with former Mayor Williams, Mayor Finty, the chairman of the council, myself, and some other folks. And the committees that I'm overseeing as a steering committee are the faith, sports, entertainment, large events, and then the small business community. There's committees of that. There's probably about 100 people that are putting together recommendations, looking at research, looking at what's out there to come up with an opening plan. Exactly what would we? So when the healthcare data is proper to open, and I know Virginia and Maryland are looking at the same way. When the data is proper to open up safely, how do you open up? Which sectors open up first? How do they open up? What are the new rules and regulations? This task force has been given the assignment by the May 12th to deliver recommendations to the mayor on what that plan looks like for every different sector of the economy. And you can see that on the government website as well, the committee and the task. There's a public forum tonight where people can come in and give their comments about what they think should be done. It's a survey going out to all DC residents, and then that will be some of the feedback, as well as access to healthcare professionals and other experts are being assigned to the committee to help us come up with a rational plan to come open safely and to minimize the impacts of this virus. Why we wait for a treatment or a vaccine, how we do that and how we phase that in. So that's what we're doing, and it's, as Aubrey said, it's getting the testing and tracing and getting our hospital capacity up for the surge, and we are converting our convention center to 500. It could go to 1,000 bed hospital capacity to help with that. So that is obviously something that's going on at the convention center as well.
Great, Peter.
Yeah, I think what people want is for politicians to stop sugarcoating what's going on. And, God bless Aubrey and Jeff for hanging in there. But this is, Jeff, or Aubrey, I want to compliment you on the Northfield medical contract that you signed for $27 million to get emergency equipment. That had all sorts of built-in protections against price gouging and war profiteering, I call it. So thank you for doing that. Our governor negotiated with, of all things, the government of South Korea for 500,000 or 1 million tests. Let's just be honest with people. The ball has been dropped by folks at the federal level as far as any kind of testing or preparation, really, game plan. So the states are on their own. The question about returning to some degree of consumer confidence, I don't think it's going to happen until we have a therapy that works at a minimum, and ideally, as Jeff was saying, a vaccine, which I am very confident the global scientific community is going to produce. They're all over this. But I think we're just whistling by the graveyard if we say, let's open up all these small businesses and people will come back. They're not going to.
Yeah, that's going to be difficult. I mean, we're looking at, so I know, we're familiar with the different task forces that are beginning to convene at this point. So the Board of Trade actually has one, and we do have representatives from the 3 jurisdictions, from both governors and the mayor, working on that, really looking at regional issues. We do think that tracing ultimately will become a regional issue for it to be really effective. As well as just how do we coordinate a lot of the messaging around this too. 1 out of 5 workers in our region crosses a line every day to go to work, not to mention, for recreational activities and other things. And so there really is an opportunity here for us to be even more integrated. And we touched on that a little bit earlier, but even more integrated than we've ever been before, and how we're going to approach this and how we're going to restore that level of confidence out there. And we would agree, it's going to take us time. This is not going to happen just, by declaration of that we're going to start reopening, and we're going to have to be really mindful of that. But that's going to create a whole...
If I can interrupt, I have a lovely person who is extraordinarily successful and wealthy who lives in D.C. and called me a month ago and said, I need classification for one of my employees to come over and help me in the house. He's living in Maryland right now. So I took advantage of my high office and gave him a unilateral dispensation. But yes, that's a real problem. I hope that we can deal with that. And I just, want to reinforce once again, without testing, without contact tracing in place and more or less available to anyone, it's very hard to say to people, oh, by the way, take your, let's play Russian roulette here and come on down and go back to normal, because you might catch a disease that we really don't understand medically right now as to how it damages certain people and not other people. So I think we've got until at least September, October before hopefully the region, obviously all of us want recovery, but I think we need to really keep to what works. And you mentioned leadership. This Dr. Fauci guy, he's one of my new go-to people because he's more or less tells it like it is. And I think we need a little bit more of that at the national level, and we'll get through this just fine.
So we've talked a little bit, so if we start thinking in terms of, either September or October, I mean, that's still pretty far out. We'll likely see components of the economy reopening sooner, but it's still going to take some time. Aubrey, you had mentioned that you all have a $2 billion reserve fund. Just, as you manage liquidity, as you think about this, just from a government perspective and public budgets, how well prepared are we to get through till September or October? And what is that going to look like?
Well, Jack, I would say we'd be better prepared if the stimulus funds that the federal authorities have allotted us would have a little more flexibility with them. And maybe that's something my cohorts will mention also there. Obviously, we don't think that the funds should be used to, as some people have said, bail out states. But if you look at all the other stimulus packages, whether it's the hospitals and the businesses, they're pretty much to be used even for replacement of revenues. And so I think that would be key for us in better preparation if we had a little more flexibility. Grateful for the monies, but they're fairly restrictive and only being able to be used on very direct expenditures with this virus. And that includes the local share too, the localities we pass on. And many of them that we've already heard about how the hospitality industry, the leisure industry has been hit so hard. So meals taxes, lodging taxes are very much hurting. The lesser of those are hurting a lot of the localities across the Commonwealth. But what we're planning to do, as I said earlier, is liquidity is king now. We monitor that, and particularly with the ability to our cash reserves. Certainly, the Federal Reserve has offered a short-term program where you could access, but you've got to have a payment source that's already identified because they can't take losses. So while it's helpful in the short term, I don't see it as being very much useful to us in the long term. But from our perspective, it is pretty much managing the receipts in, looking at our liquidity. We've asked, as I mentioned before, we've stopped discretionary spending, so there should be some balances left in these agency accounts as we get towards the end of the fiscal year. So we're using everything at our disposal and trying to use federal dollars, stimulus dollars, everywhere we can because of the flexibility of, in our case, general fund dollars are so much better for us in order to respond not only to the crisis, but to better plan for the other side of this, helping businesses getting back on their feet when the economy does open up. So that's the approach we're taking here.
Jeff, how about in DC? And there was a significant shortfall in the funding that was provided to states with regards to DC. And so how are you addressing this issue, managing liquidity? And, with that shortfall, I know we're working on it, and I know a lot of other folks are working on it, but what are you hearing about that? And what else can we do to be supportive there?
Well, in terms of, as Aubrey said, it's all about cash. I talked to the treasurer in DC, reports to me as a CFO. So I'm on the call with him twice a day as we're monitoring liquidity and expenses and these large purchases that you have to do to staff up and do things for this crisis. As you mentioned, we got about $498 million being treated as a territory, as opposed to $1.25 billion being treated as a state. And we're expecting our current estimate minimum, very conservative, meaning lowball number, is about $600 million we're expecting through September. So we don't have the funding from the CARES Act to even cover what we are expecting our expenses to be, which is additional budget hit that you may take. We're looking at FEMA money and everything else. Fortunately for us, thank God for 2019, as I like to say in the district, and our economy was roaring along really, really strongly before this hit. So our reserves are we're at record levels to start this. But even with that, we've went in and tapped into some additional liquidity facilities through some banks, just in case, to deal with where our cash flow hits the bottom in August before our September property taxes come in. So we're ensuring we have liquidity through the cash flow cycle that you run in every government. I was a CFO in Phoenix, Arizona during the Great Recession, which took 25% cuts back then. But the liquidity hit and how fast it is, I've never seen anything like it. That one came gradually over several months. This one is fast and rapid, and suddenly your property taxes so your sales taxes coming in April and May are relatively non-existent. You've deferred your income taxes to July. So liquidity is the major thing that you look at. But luckily our reserves were high, But my concern is getting the fair share of our CARES Act money, because what we got does not cover our low estimate of what our expenses are going to be. And if we don't have that, we're going to be covering with our general fund, and the cuts we're looking in revenue would be even greater.
Yeah, could I just make a comment?
Yeah,
Because
please.
I'm always stunned by the fact that here we are in America, the greatest country in the history of the world, and we have literally been brought to our knees by a virus. I agree, it's a new virus. And now we've got this economic collapse going on. How did that happen to the greatest country in the world? Well, part of the responsibility lies with the politics of how this happens. And this reimbursing states for some of their fiscal problems right now is just part of that. I thought the comment by Senator McConnell and the comment by Senator Rand Paul that somehow they're not going to send any money to states that are Democratic and because they're inherently poorly run. I mean, that is just the essence of what the problem is right now in this country, because everything is viewed through this political lens. Testing, contact testing, everything that is directed towards this has got this crazy partisanship mixed into it. So on the liquidity issue, we have $1.2 billion in our rainy day fund. I'm suggesting to the governor that he spend every bent dime of it. We are in exactly the climate that a rainy day fund was designed for. I'm happy to report that we are a very, very high liquidity state. In these types of emergencies, all sorts of pots of money all of a sudden become apparent to people like Aubrey and Jeff and myself. So there is no question that we are liquid and will be liquid in the state of Maryland. However, we are going to, we have a freeze on hiring. We're obviously going to furlough people. We're obviously going to terminate people. There's just no ifs, ands, or buts about it. We'll try to do it in a way which is constructive rather than negative. But, I just want to salute Aubrey and Jeff again, because everything that they say is what is appropriate. And thankfully, our teams are working together.
So, all right, so when you raise that point too about furloughs and hiring freezes and other types of things, how are you all advising the governors and mayor with regards to setting priorities around reducing expenses on that, in order to make up for some of these shortfalls in the short term?
I'll go first, I guess. The issue is in the district we've been booming for the last decade. So they're used to getting, in our case, about $300 to $400 million more a year to spend, and this year we're saying you have $700 million less. So having, I talk to the largest city CFOs regularly. I'm friends with probably the 25 largest cities. I'm friends with many of them, and our treasurer is on the weekly calls or biweekly call or twice a week calls with the National Association of State Treasurers. So we're talking both at the state and at the district level. And ours is bad, but there are cities out there that are far, far worse than us. We're talking the 40% range in some cities in God help Las Vegas, with 30% of their employment being the hospitality industry. So what my comment to, and I was on a call this morning with the council member, is you have to look at what you really should be doing, not what you would like to be doing, because it's a time to reprioritize. I got a message from the city manager I work for in Phoenix, Arizona, when we had to do 25% cuts. And his text message says, remember, this is the opportunity to do things you always should have done but never could. Remember that. And I kept that text message because that is, and that's my advice to the mayor and the council as well. This is the time to look at what is a priority, what you need to keep going to recover, what you need to keep the economy going along, and you have to make decisions. You can't do everything you did last year. You have less money, and we have to have a balanced budget. I mean, all of us, Virginia and Maryland are one of the 8 AAA states in the country. There's not many of them. We have a AAA rating as a city or a state, whatever we are, with Moody's, and so you're looking at 3 of the probably financially strongest cities and states in the country. And so my comment is act like it. Act like you're a high quality credit. Act like you're making the right decisions. Don't do gimmicks. Don't try to balance this with games. It's structural. It's going to be for a while, and you're going to have to set priorities. That's the advice I've been giving the mayor and council.
Yeah, Aubrey.
I want to really piggyback on what Peter and Jeff have said. This is difficult enough in a normal environment. In a political environment, it's even doubly so, particularly when you know some of the comments were just rhetoric and can't be obviously anybody with a realistic outlook as to how we have to go from here. Much like Jeff has said, we've got to be realistic. That's been a little more difficult in Virginia. As you know, this past year was the first time we've had consolidated government. We had a takeover by both the House and the Senate by the Democratic Party, and we have Democratic governor and consolidated leadership. There was a lot of pent-up demand in that takeover on some things that we thought were going to be able to be passed this year. And of course, now with this and spending with this reduction within revenues, that's not going to be able to happen. So having to make sure we put some realism into where we are and how long it's going to take us to come out of this. We have not had mandated layoffs in the Commonwealth yet, but we've had people that have, like for instance, at our museums that use non-general fund revenues to keep their jobs. That is now shut off, so they're no longer employed. And I expect that as we look at the other side of this, and this reforecast we'll have this summer, that we'll have to take additional actions, not only suspending some of these items, but actually virtually having to cut them. And so, again, as much as like Jeff has said, that we've got to be realistic. I think I view my role, and I'm sure Peter and Jeff do the same. We've got to be the ones in there saying, here's what's actually going on, and we've got to do what we must do. And sometimes that's not what we want to do. But continuity of government, responding to the personal, this health crisis is number one on us. Of course, making sure that we have a balanced budget is right in there. So not always easy conversations to have, but that's the approach that I think is right during this situation.
Yeah, I mentioned I have a very positive relationship with Governor Hogan. I'm going to defer to him and the legislature, at least initially, as to how to deal with this situation once we've stabilized it. I emphasize we have to make sure our programs like the unemployment claims are operating. I mean, it's hard to go to people and say we're going to make major reductions in things if we don't have our own act together. So to the extent we can make sure that we get through the next 4 to 6 weeks, I guess, taking care of some of our folks, that would be the most important thing. After that, on the recovery, I think we're simply going to have to realize that once we win the medical battle, we can't really do anything unless we win that, and I think we are going to win it. Then we have to win the recovery. And for that, we've got to change our perspective. I mean, in Maryland, we're all about big business. Hey, how about small businesses? And we're all about raising taxes to help the state budget. How about the budget of Maryland families and Maryland small businesses? What about their budgets? So you know what I'm talking about. It's basically, whether you're Democrat or Republican, it's a new kind of universe that we're entering into. And I think there's some positives, and I think Aubrey and Jeff have certainly hit on some of them. Thank you.
So small businesses keep coming up in every conversation, and it's coming up in this one as well. So how are the various relief programs working in the states and in the district? What else needs to be done? What are we thinking about around small businesses? How are you all advising small businesses right now with regards to just preparing themselves to get through this? And what else do we really need to be doing there?
Well, sorry, go ahead.
You guys always start. You get the
Peter, go ahead.
Time, then I have to get crumbs off the table here. But I've told all of our small businesses, number one, they have a tax holiday. They don't have to send us any taxes at all, any fees, any renewals, any money whatsoever that they owe us. They can hold off for 90 days. It's a forbearance, and they should use that money to keep it in their pocket and try to keep their businesses alive. I've told all small business owners they should do that on an individual basis. They should call all their creditors and ask for forbearance until we get through the immediate damage of what we're going through right now. So as a tax collector, I'm busily telling people not to send me taxes. And once again, that's out of a concern for the fact that we just can't get our arms around how much damage is being done. We've got 175,000 small businesses in Maryland. Probably 40% of them are not going to survive. And that, none of us can step in and stop that because it's already happened. They've already laid off people. They've already made personal decisions not to reopen. But I think with a new perspective after we open up, we can direct our policies towards things that help them rather than, at least in Maryland, I'm not suggesting DC or Virginia's like we are, but we've had a very endless appetite for tax increases over on our side of the river. And that is going to be a thing of the past.
Okay. Jeff, do you want to?
Yeah, I agree with everything that Peter said. The issue that we have, as I think he was alluding to, is this is bigger than we can take care of. Many of these businesses are already struggling to open. 40% of the restaurants are closed. The Restaurant Association itself thinks that half of those, or 20%, are not going to reopen. And just we need the federal PPP program to work. We can't put enough money in to help solve their problems, given that we all three have our own fiscal issues ourselves that we're dealing with. If you do that, then it's a bigger fiscal issue that we're dealing with. But an example on the PPP program, and I'll just use the Restaurant Association, that needs to be fixed. Only a third of them applied because the rules to make it a grant is you have to have these people employed by June. And how do you employ them by June if you're still possibly shut down? And many of them are on the unemployment rolls, and some of them, because restaurants often don't pay a lot of benefits, some of them are just as well off on the unemployment rolls as they are being employed, so they can't get them back. So it's a program for the Restaurant Association that doesn't even work. They can't bring the employees back in time. In other words, they're taking out another loan and incurring more debt, which is why only a third of them had applied. And of the third that applied it, as of a week and a half ago, only 20% had received the funds on it. So that program needs to be fixed for that industry, which is, we believe, one of the recovery areas of the district is getting the hospitality industry going again. But I think what we tell businesses is, as Peter mentioned, we deferred property sales tax payments for March and April. They are not due for 90 days later, so they get to defer their payments. And we deferred income tax payments. And for the hotel industry, we deferred property tax payments as well to try to help give them liquidity to get through that. But our capability to do that forever is we can't. We have to keep our businesses running as well. So my comment to the business community, I've talked to them quite frequently, is we're not big enough to help you. We need ideas, but we need to lobby the federal government. This is so big, and this is every city in the country. Every CFO I talk to has exactly the same issue, is it's bigger than they can deal with by themselves.
Yeah, we almost need a Marshall Plan for the U.S.
I would agree with that. Basically.
Okay, well, we'll work on that.
Yeah, thank you.
Yeah,
I'm
Aubrey?
looking forward to that high-speed train between D.C. and New York City. That at some point is, but you know what I'm talking about. And thank you, Jeff, for even mentioning me and that stuff. And Aubrey, once again, you guys are the best. And, we're lucky we have good leadership in the region.
Yeah, Aubrey, small businesses in Virginia, again, everywhere they're the lifeblood of our communities. What sort of impacts are you seeing there? And
and first of all, what Peter said, we have got to focus on small business. And obviously, I think big business will continue to look at our localities, but we need to focus away from that. They make great headlines, but we're going to get this economy back on track. It's got to be the small business, the ones that have been impacted. Just like Jeff said, a big part of this has got to be the federal government, whether it's through the payments to individuals or their PPP program, which has had some glitches. It looks like there's some more money in that now. Here in Virginia, over and above that, gaming was a big issue this year. certainly games of skill, and they were going to be outlawed until this crisis hit. And what the General Assembly and the governor have allowed through our budget is for them to operate for another year, but be taxed or levied, whatever the appropriate word is, for the gaming proceeds. And that's going to generate about $150 million a year that Virginia is going to use to help supplant what the federal authorities have done to get small business back on their feet. And that'll be through direct grants to many of them. But I'm talking about the barbershops, the restaurants, the landscapers. Those are the businesses that really have been impacted. Obviously, hotels they throw in there, but the small businesses, not the publicly traded ones. Not that we're not very much concerned about them, but that's where I think you're going to see our focus in helping them get the resources. Many of them didn't even know how to apply for some of the federal programs. So we'll be putting monies into that to help them get to where they can get through this terrible period here. And I don't think it's going to be just for a few months. I think they're going to need help for, in the foreseeable future. And so that's one of the ways that we'll be able to try to help them on the other side of this public health crisis.
Great,
when
thanks.
you get a barber shop open, would you let me know?
Yeah.
I need to scoot over there.
So, well, we've touched on it a little bit. Just walk us through your thoughts, too, about the reopening and the various phases and what that timing might look like as we move forward. I mean, I think we would agree that it's going to take time, but what does that look like for us?
I'll start. At least in Virginia, part of the complicating factor to this is the mixed messages we've been getting out of DC. I don't mean to say DC, the White House, in terms of we issue guidelines, and then all of a sudden there's tweets or whatever that liberate Virginia or do something. That's not very helpful to our citizens in understanding how we want to have. Not only are we very much concerned about their health, but we have an organized method of reentry. What Governor Northam has said he's going to follow generally the CDC plans, which were laid out by the White House, looking at our number of cases, our hospitalization usage. And then that will be sort of the start to a phased reopening where the governor said he's more favorable to a regional reopening instead of a statewide, where we can look at different parts of the Commonwealth and different industries. For instance, in Northern Virginia, teleworking seems to be doing very well. Maybe not so good in Hampton Roads, where they're dependent on tourism and shipbuilding and other types of infrastructure down here. So we'll be looking at it from that perspective. But the whole key will be back to this testing and contact tracing. I don't think whatever we do without a robust program there, I don't think we're going to see the customers coming into these businesses. And so that'll also be a part of that combination. So sort of summarizing, it'll be a initial, a pre-opening where we're looking at what industries can go forward, and then the governor making decisions based on different regions and parts of our economy as he gets more comfortable that we'll be able to protect the citizens as we move forward.
Ours is very similar to what Aubrey just mentioned. Is the mayor has made it clear in the Reopen DC, we're going to do it based on the science. We're going to look at the science. We're going to make sure the testing and tracing and the hospital capacity is in place and open it in that manner. And ours is we literally have many different groups looking at every industry area, and they'll all be different. I mean, if I think Peter was alluding to, if Aubrey opens up barbershops first, we're all going to go to Virginia to get our haircut to start, and he'll get that business at least. But it's how do you phase it up in a logical way, industry by industry. I believe the large events are probably going to be the last things to open up. You're not going to see as much as I'd love to go to a Nationals baseball game. That stadium's not going to fill up right away, and those are probably going to be your last things to go. But you can phase in your restaurants with proper spacing, and you have to look industry by industry by industry. Restaurant Association will tell you they need to be at 50% occupancy, or they'll just continue takeout because they can't make money and add the staff to do that. So all those, what the industry can do, what is safe, what the phase-in is, and that's until you get, as I think Peter alluded to earlier, a vaccine in place. You can't really go back to where you were. So how do you phase it in? I think it's industry specific, and I agree with the comment. It would be better to be regional. So I don't go across the river to get my hair cut. I'm doing it in DC and keeping the taxes there. This is an example.
Great, thanks. Peter?
Yeah, if I could just mention again, I think Governor Hogan and Governor Northam and Mayor Bowser are doing absolutely the right thing. But they're kind of caught right now all in the middle because they're doing the right thing on the health issue. But before the health issue is resolved, there's all this political chatter about liberating folks from something they view as, I don't know what they view it as, but frankly, it's crazy for me to see people demonstrating right now saying liberate Maryland. Jeff, you mentioned a U-shaped recovery. I hope very clearly that it is a robust recovery down the road, but the worst thing we could have is a W-shaped recovery. Where we end up with a resurgence of this nasty virus. So I think we should go slow and realize that the pressure that's being applied to the rational governors and mayors to reopen prematurely is simply that. It's political and it's partisan, and I don't know whether it's partisan. I can't blame it on the other party. I wouldn't even go so far as to say that, but it's a appeal to people's populism, I guess, in a very negative way. And I just wish we could all understand that we're trying to do the right thing here. And I don't think we're going to open very quickly. Our latest, I don't know what Governor Hogan's going to decide, but I would urge him to continue to, put public safety first and don't buckle to whatever these contrived demonstrations are.
Just to build on what Peter just said, we did scenario modeling of a W shape. In other words, we go down, we're U. But we looked at it as, what if you open up, let's just say in the midsummer, and then in the fall you have to shut down again and start again? Instead of $700 billion, it was well over $1 billion of a budget deficit. So that second shutdown is really, really costly to your economy. So to forget the health care issues aside, a second shutdown is really, really damaging to your revenues.
Yeah, just to reiterate, that's why if you want to fix the economy, fix the public health crisis.
Right, totally.
That is the quickest way to get us back to whatever normal is going to be.
Okay.
So I couldn't agree more with Peter and Jeff on that.
All right, so that would be the one primary thing that you would reinforce with the governors and the mayor. So we got to get that part right.
Yes.
Okay.
It's key. Got to get it right.
Well, we've run out of time. I still have a lot more questions, but we're going to end there. And I really want to thank you all for joining us and sharing your thoughts and insights with us. It's very helpful. I mean, as we move forward, we'd love to have you come back maybe in a couple of months and kind of update us where things are at, because we agree this is going to take us some time, but we will get through it. And we're going to have to be more creative and innovative probably than we've ever been before, but we will rise to that challenge. So I want to thank you all. I want to thank everybody else for joining us today and for participating. Next week, we're going to take a look at emerging cyber issues, and we're also going to look at some concerns around mental health issues. So stay tuned for those. And with that, everybody, stay safe, and look forward to seeing you all soon. All right, thanks all. Thanks, Aubrey, Jeff, and Peter.
Take care.
Stay safe.
Here, guys. Thank you very much.
Okay, bye-bye.